Hello and welcome to the ADCES's podcast, The Huddle, Conversations with the Diabetes Care Team. In each episode, we speak with guests across the diabetes care space to bring you perspectives, issues, and updates that elevate your role, inform your practice, and ignite your passion. I'm your host, Jody Lavin-Tompkins, the Director of Accreditation and Content Development at the Association of Diabetes Care and Education Specialists. We're barely into spring at the time of this recording, but we're already looking forward to summer. Today we're talking about the ADCES annual conference taking place this August in Baltimore. I know our members and many others on the diabetes care team are especially looking forward to meeting in person this year after 2 years of being relegated to a virtual conference by the pandemic. We're back and better than ever though, as ADCES22 will bring together speakers from all backgrounds and scopes of practice to share their expertise. Our industry partners will also be present, and this year, you can expect some new session formats to make learning about new products and services engaging. You'll hear plenty more about what you can expect this year, but if you're running short on time and want to skip straight to the good bit, registration is now open at adces22.org. Head over and sign up today to lock in the best possible rate for the conference. Joining us today is Susan Weiner, this year's annual conference program committee chair. Susan is a longtime diabetes care and education specialist, a registered dietitian and nutritionist, a fellow of ADCES, and she also served as the Diabetes Educator of the Year in 2015. As the leader of this year's program committee, she's the best person to give us a quick, detailed overview of what this year's conference has in store for you. Susan, welcome.
Thank you so much, Jody. I am thrilled to chat with you today about the ADCES22 live conference program.
That's great. I'm sure our listeners are wondering what the priorities were for the planning committee, what they had in mind as you started planning this conference program.
The conference planning committee, ADCES staff, and our president, Jan Kavuchkin, along with myself as this year's conference planning committee chair, are so very excited about the professional and educational opportunities to be presented at ADCES 22. This is the event of the year for diabetes care and education specialists, and we needed to make sure we had a lineup fit for the occasion. This year, we put a lot of thought into reaching out to new and exciting speakers, many of which are presenting at our annual meeting for the very first time. Since COVID, there are additional issues to contend with, and some of them are obvious, like tackling distance learning and the challenges surrounding communication. So in addition to planning the conference to include cutting-edge research and educational sessions on all aspects of diabetes care, technology, medications, and assessment, we are providing sessions on clinical inertia, social media, connections, and delving into complex mental health issues for all people with diabetes. It was important for all of us on the planning committee to encourage submissions on a broad range of topics which affect the entire diabetes community.
Well, you've told us a lot about the conference already, but I know the education at the conference is organized by tracks. Could you tell us more about this year's tracks and why these areas are so important to the healthcare environment and the diabetes care team?
Of course. We have 135 sessions in total. They're featuring new speakers from all areas and specialties. And this year's educational tracks include diabetes in practice, diabetes and the cardiometabolic continuum, psychosocial and behavioral health, clinical and self-management care integration, inclusive person-centered care, leveraging technology, devices, data, and patient-generated health data, and research. And although research isn't a specific track, we're going to have a number of educational and research sessions, including research posters. There will also be a lot of cultural aspects covered in the session. We even have a session on food as cultural heritage, a look at Eastern religions, which will be really fantastic and interesting. We will have up to 44 CE credits available in total, up to 23.5 CE and CME available by attending in person in Baltimore, and up to 20.5 CE, CME available on demand. The on-demand sessions will be included with the in-person registration. So if you attend in person in Baltimore, you're already eligible at no extra cost to get the available on-demand sessions. We will continue to offer CME as well as CE for nurses, PAs, dietitians, and pharmacists. And very exciting this year, we have added social work credit.
Oh, that's great to hear. We also want to highlight topics that are front and center for us today and will likely be in the future. Can you tell us more about the topics being emphasized this year?
Each day at the conference has a specific theme. On Friday, we will be discussing diabetes and cardiometabolic conditions. And on Saturday, prevention, prediabetes, and pediatrics. On Sunday, technology and challenges in diabetes care, and on Monday, maximizing engagement with diabetes services. And throughout the entire conference, there will be discussions on advocacy and updates on public policy. We've even lined up the most amazing keynote speakers for each day. Friday starts off with the Associate Director of the Motivation Science Center at Columbia University, and that would be Heidi Grant, who will be speaking about what successful people do differently. On Saturday, we will begin with a moderated session on delivering equitable care to people with higher weight bodies. And on Sunday, we have a moderated session on reducing health disparities in urban and rural populations. And after all this, we wrap up on Monday with unique sessions that highlight topics like the new metric for CGM. It's all just so exciting.
That all sounds great, and I know that everyone loves to go to the exhibit hall, so I'm sure many attendees will be looking forward to that face-to-face interaction with our industry partners and being able to actually walk down physically the exhibit hall. So what can attendees expect this year at the exhibit halls and the education theaters?
Jody, the wait is over. Exploring the exhibit hall with colleagues and friends is something we've all really missed over the last 2 years, and I know I'm really looking forward to exploring the exhibit hall. There will be 9 hours of dedicated exhibit hall hours to meet with and interact with industry partners. So those 9 hours will not be opposing any of the educational sessions, which is phenomenal. We will have 9 education theaters, hands-on training pavilion. There will be 3 industry coffee talks. This is new. It's an informal 30-minute sessions on new products and services led by industry. At center stage, we'll have 15-minute spotlight plus briefs. That will be a Q&A on new products and services. We will have education and research posters with audio recordings of the abstracts, and you can take a self-guided poster tour, so you do that at your own pace. ADCES Pursuit, which is a fun game, brings you chances to win fun prizes. You will visit select booths and answer questions to get stamps that you can use towards an entry for free registration at ADCES23.
Wow, Susan, there's so much for our attendees to be able to see and hear. It is very exciting.
It certainly is.
But I want to know what excites you the most about this year's conference and educational programming.
Jody, there's so much that I'm looking forward to, but there are a few very special things that I'm especially looking forward to. One is the meditation session. We all need to combat professional burnout, to be mindful and stay in the moment about where we are. And we have 2 wonderful people who have been living with type 1 diabetes who will lead us through mindfulness and compassion practices and what has helped them while living with diabetes. And I, for one, am really looking forward to attending that session and bringing along many of my colleagues. I'm also looking forward to the Time and Range Coalition presentation. We invited Diatribe, which is the organization leading the effort to advocate for use of time and range as a metric for care and research, in addition to A1C. Diatribe will present their field research results with people living with diabetes and clinicians and advocacy efforts with agencies like the FDA. ADCES is a proud partner in this coalition. I'm also looking forward to attending more sessions on pediatrics. We have sessions that include type 2 diabetes in youth. And we have 2 presenters on the social media aspects of diabetes care and education. And whether you have been involved in social media for a while or you want to learn more about it, these sessions are very important as we continue to communicate throughout our community and with people throughout the diabetes community. There will be new presentations, new faces, so even if you've attended this conference in the past, you'll hear new perspectives and new voices. And again, remember that anyone who registers for the in-person event also has access to the on-demand virtual component. So I'm looking forward to all of it.
Wonderful. And I know, Susan, that those social media presentations are near and dear to your heart. So I'm glad that we were able to bring them in. So I want to thank you, Susan, and ask if you have any final thoughts for our listeners.
Yes, Jody, I have a few thoughts, and I wanted to thank everybody for tuning in today as well. The Planning Committee and ADCES staff put together incredible sessions, speakers, and an expo hall and special events, which are truly a home run. Seeing our colleagues and peers in person to share the experience will make ADCES22 in Baltimore a grand slam. This conference will be informative, inspiring, and enjoyable. And please feel free to reach out to ADCES or me directly if you have any questions regarding the conference. I can't wait to see everyone in Baltimore. Thank you so much for your time today.
Well, and thank you, Susan, for your time. And it's been a joy to work with you this year in the lead up to our conference. Thank you for listening to this week's episode of The Huddle. Susan outlined what is sure to be a fun and engaging way to recharge your professional motivation and reconnect with friends and colleagues in diabetes care and education. Be sure to mark your calendars for August 12th through the 15th and meet us at ADCES22 in Baltimore. Registration is now open, so head over to ADCES22.org to learn more and register today. And remember, if you are not an ADCES member, join us today and you'll receive a $100 discount on your annual conference registration. Being a member also gets you free access to resources, education, and networking that improve your practice and optimize outcomes for your clients. Learn more about what ADCES can do for you at diabeteseducator.org/join. To access notes from this episode, head over to diabeteseducator.org/podcast. The information in this podcast is for informational purposes only and may not be appropriate or applicable for your individual circumstances. This podcast does not provide medical or professional advice and is not a substitute for consultation with a healthcare professional. Please consult your healthcare professional for any medical questions.